Hey, we're back. And hopefully, if you just finished up part one of the endocrine system, or you've seen it before, this will be part two, where we'll go ahead and complete discussing the rest of the glands and organs. And then we're going to talk about some of the effects of aging and some of the disorders that come along with it. So let's go ahead and dive right into this PowerPoint. Okay. So endocrine system part two. Da, da, da. No, I'm just kidding. Um, I haven't had any coffee yet this morning either, and I'm like this. So this is what my day is going to be like. All right. As always, if I could please ask you to hit the like and subscribe, really helps me, means a lot. And we will go ahead, get rid of that, and let's jump back in for part two. All right. So we had talked about a good number of the organs, a good number of the glands. Let's go ahead and continue on with the pancreas. So the pancreas is located just behind the stomach, so posterior to the stomach. The pancreas, if you've seen my digestive video, is also part of the digestive system. It has an exocrine function in the digestive system. But its endocrine function has to do with a part of the pancreas called the islets of Langerhans. I love to say that with the accent, Langerhans, um, that secrete two different types of cells. So they secrete, or there's two different types of cells that secrete things. Let me put it that way. The alpha cells secrete what is called glucagon, and glucagon's sole purpose in life is to raise blood glucose levels. Beta cells secrete insulin, and insulin's sole purpose in life is to lower blood glucose levels. So we have alpha cells for glucagon to raise the blood glucose, and insulin from beta cells to lower the blood glucose. And as you can see, the parts of the pancreas are as such. There's the head, the neck, the body, the tail. It's kind of a long organ. It's very soft too, so it needs protection. Um, just for reference sake as to where it is, here's where the gallbladder is, and here's where the beginning part of the small intestine is. So just for reference there. Moving onwards, and we'll talk about the issues that can come along with problems with insulin and glucagon and stuff when we talk about the diseases. Moving on to the gonads, which are the primary reproductive organs. If you've seen my reproductive video, you know all about these. Highly recommend that one if you haven't seen it. For males, it's testes, and for females, it's the ovaries. So for as far as hormones go, um, the male testes produce testosterone. This happens at puberty. And what occurs at puberty is a lot of changes start to happen due to the increased secretion of testosterone. The growth and the development of the reproductive organs start. Um, the increase in skeletal muscle for males, enlargement of the larynx. Testosterone has a really big effect on how thick the larynx is. That's why you hear little boys or voices start to change at this point, and they get that sound going on. Sometimes it's actually kind of funny, but this is what deepens their voice. And then the growth of body hair also. For females, the ovaries produce both estrogen and progesterone at puberty. Um, they both aid in breast development, distribution of fat. This is where you see females start to get, hips and they don't look straight up and down like they did when they were little girls. The maturation, of course, of the reproductive organs, and then the thickening of the uterine lining. That's mostly progesterone's job, is the thickening of the uterine lining because each month again, check out the reproductive video. Each month, that lining has to prepare for the possibility of an implanted fertilized ova to start the development of a fetus. So that is what the gonads are responsible for. We also have the pineal gland. This poor gland kind of doesn't get the spotlight as it should. It is small, it is cone shaped, it is located in the brain right here. So, for just purposes of understanding where things are, here's where the pituitary gland is, here's where the pineal gland is. It has specialized cells that synthesize melatonin. I think we all know about melatonin. Melatonin gets secreted in high levels at night and gets secreted in lower levels during the day. And it helps to regulate circadian rhythms, so our wake and sleep cycles. The thymus gland is located near the midline of the body. As you can see, here's what it looks like. Very similar in shape to the thyroid, actually. And it's just below the thyroid. It's right behind the sternum, so in the chest area. It produces a hormone called thymosin, and thymosin helps to develop and produce certain blood cells called T cells that help to protect the body. They play a role in our immune response. What is interesting, I think, about the thymus gland is when someone is born, their thymus grows with them, as almost all of our body does, but reaches maximum size at puberty, which, again, not uncommon for a lot of the parts of our bodies, right? But then starts to decrease in size as we get older. Um, and it's not that it doesn't do its job anymore. It's just parts of it get replaced by actually fatty deposits. So it just is not as large in adult life as it once was. Okay. Here is a little map. You can screenshot this. In fact, I recommend you do. This is what I call my endocrine map. And this kind of sums up the whole system. So you have the hypothalamus up here, right? And as we had mentioned, the pituitary gland is connected to the hypothalamus by the infundibulum right here. Here's your posterior pituitary, here's your anterior pituitary, okay? And I didn't go a whole lot into it, but the hypothalamus actually releases certain secretions to tell the pituitary to release things too. So just so you know that that's a thing as well. It kind of kickstarts everything. But this diagram is great because it shows the various hormones that are secreted by the anterior and then the hormones that are secreted by the posterior, and then what they do basically. Now, two that I did not really delve into a lot were oxytocin and prolactin. So prolactin aids in milk production in the breasts for females. And oxytocin helps to release that milk. Plus, it plays a part in contraction of the uterus, especially during childbirth. So, just so you're aware there. But it shows these like, here's what growth hormone, for instance, comes from the anterior pituitary, and then its effects are felt on the bones, muscles, and organs. LH and FSH, of course, affect both the ovaries and the testes, and then it stimulates those to then produce these hormones. Same with the adrenal gland. ACTH acts on the adrenal cortex to produce cortical hormones. TSH acts on the thyroid gland to produce thyroid hormones, so on and so forth. Okay. So this is really kind of a good little diagram. And like I said, I highly recommend that you screenshot that. All right, so let's talk about effects of aging and disease. So glands do tend to atrophy a little bit as we age, as many parts of our body do, to some degree, but there's really no evidence that any of the structural changes of the endocrine system or the parts of the endocrine system have any significant effect on it. What does have an effect on it is the decline in the hormone secretion. So as we age, these hormones that secrete normally, that secretion rate starts to decline. And so that can result in changes to whatever target tissue they are affecting. Okay. So it's not so much the structure as it is the amount of hormone that's being secreted, and therefore the effect they are supposed to have on certain tissues. That's where the change comes in. Now, there's many disorders to talk about. We already mentioned a couple of these. Myxedema, of course, is severe hypothyroidism in adults. This can result in thinning hair, puffy eyes, dry skin. One I had not mentioned is a genetic disorder that causes rapid aging in children called progeria. If you've ever seen a progeric child, they're the size of a child, but they look like they're 80 years old. It's a really sad disorder, and like I said, it's genetic, so unfortunately, there's not a whole lot that can be done about it. Cushing syndrome, it results from having too much cortisol. The various types of signs and symptoms of that is a fatty pad in the back, just below the back of the neck, which a lot of people refer to as a buffalo hump. Moon face, meaning your face gets really, really round, and they generally bruise very easily. Type 1 diabetes mellitus. Type 1 is usually juvenile onset, usually results from either a genetic predisposition, um, and and I say usually juvenile onset because there are many cases where people get diagnosed with type 1 in their like 20s. Um, the symptoms are excessive thirst, frequent urination, weight loss, hunger, excessive hunger. Of course, can be treated with insulin, medication, dietary changes, all of the above. Okay. Type 2 diabetes is adult onset and is usually caused by lifestyle, honestly, being overweight, poor diet, things like that. Also could be genetic as well. Same symptoms as type 1, and can be treated and managed basically the same way, medication. There's some type 2s that are insulin dependent, but that's more a type 1 thing, and dietary changes. Graves' disease is a thyroid related disease where there's too much thyroid hormone. This can be, excessive hyperthyroidism, weight loss, goiter, nervousness. You can see changes in the eyes, bulging, swelling, pressure, dryness. Addison's is an adrenal insufficiency, so the adrenal gland is underperforming. Um, you can see things like fatigue, GI issues, weight loss, thinning hair, hypotension, so low blood pressure. Several things that can result from Addison's. Okay, so thank you so much. I really enjoyed talking about the endocrine system with you. Hope you learned something. As always, please, if you have any suggestions for anything you would like me to cover that I haven't already, or you have any questions about anything, need clarification, please drop all of that in the comments section. I try to look at those as much as possible, and hopefully I can get back to you. Otherwise, we will see you next time and have a good day.